Thanks, everyone. In my career, I was a global COO of a 50,000-person division of a public company. I was the last person that would have considered trying mindfulness meditation. I would have found it hippie, woo-woo, and completely not for me until my health failed and I got into a practice. So what we do at Whil is we serve the enterprise. We provide mindfulness training for employees to help reduce stress, increase resiliency, and improve their performance. Our products work on any computer or mobile device. 83% of our training occurs on a mobile phone. To give you an idea of the training, if your employees suffer from insomnia, we have a sleep program. How many Warriors fans do we have in the audience? Warriors? We have a great program on overcoming grief and loss. For anybody following the presidential elections, we have programs on anxiety, regret, judging others, shame, you name it. We really approach mindfulness as competitive advantage. So we're helping employees reduce stress and anxiety, be able to focus and show up as their best selves on a more regular basis. Everything we do ties into practices around mindfulness-based stress reduction, mindfulness-based cognitive therapy, positive psychology. We leverage that to create programs to target major illness. So the stress creates illness. We create programs to help employees deal with different areas. Most of our customers want faster, cheaper. They want to improve productivity and reduce healthcare costs, reduce absenteeism. What we do is we create programs that help employees improve things like focus, memory, self-control, healing time, and reduce things like stress, anxiety, depression, chronic back pain, and insomnia. There are thousands of studies around the health and performance benefits of mindfulness. This is my favorite image from Harvard Medical. They estimate about 50%, we humans spend about 50% of our time with the mind wandering, right? Worrying about the future, worrying about the past. Is my boss out to get me? Sex? Nothing. We spend about 20% of our time in distracted awareness, meaning we're kind of listening, but not really. And this is really bad for people's health, like in a constant state of churn and burn, the brain always working, but not actually focused. So our programs really help people to increase their sustained attention, engage the prefrontal cortex, the thinking brain, actually have people calm, focused, and in the moment as a default way of being. We fill a gap in most wellness programs. There are lots of programs out there where you can read this, get points, connect your Fitbit, get points, etc. We have an active stress resiliency program. So employees come in, they do programs of 5 or 10 minutes a day, a mix of video and audio. The 4 programs we currently have is mindfulness for professionals, 450 sessions on demand, 120 sessions of yoga on demand. We have a program for teenagers that's in 8 school districts right now, and we just released the famous Search Inside Yourself training that was created at Google, all around emotional intelligence and leadership skills. So big employers pick and choose what they like, and we launch. Every employee gets their own experience based on what they're training, how much time they have, and how they feel. We put together custom programs in the moment. There's a dashboard to capture the data. Most of our customers are tracking points and rewards and so forth. We sign up to prove ROI. We're currently working with 36 big brands. We've converted our first 5. We just came out with our first 6 case studies. This is one of the global fashion retailer. We lowered turnover 38%, which is huge in retail. Dropped absenteeism 2 days for users versus non-users, and showed ROI of about 8-fold for a global retailer. So since working with J&J over the past 3 months, our team has grown by 10. We're now 23. We've added 9 customers, including GE. We're serving 50,000 of their employees. We just launched a pilot with Target. We landed the city of Louisville. We also launched our own conference, the Mindful Business Conference, really bringing the leading brands talking about mindfulness in the corporate world front and center. That's it. Thank you.
Very nice. Question for you. How long does it take sort of to get a first pass where you have something, and then what kind of tail do you need to provide for employees for them to stay on and continue to have the benefit?
When you say first pass to launch a program with a big employer?
No, when they sort of the initial training, the initial engagement with you.
So when we put an individual employee through, they receive an email from the employer, they click through, it takes about 2 minutes to sign up. We recommend everyone start with the basics of mindfulness, so 5 or 10 minutes a day for 7 days. From there, we give the employee individual goal-based programs, right? So is it calm anxiety, is it relieve stress, is it deal with insomnia, and so forth. We have about 67% of our users use the program between every 1 and 3 days.
So the data look, really encouraging. Where are you going with peer-reviewed studies and, to just kind of put the nail in the coffin on this, as we've seen with companies in the brain fitness space in the last year, Lumosity at the top of the list, claims are made, not necessarily supported. So how are you kind of protecting yourself competitively to, anticipate that?
So all the training that we currently do is science-based. In other words, we're using techniques that have gone through trials, have gone through a tremendous amount of research. And within the next 12 months, we do want to graduate from science-based to evidence-based with our own training programs. With customers, we're also getting more and more requests to go beyond just sort of preventative, generic health and wellness, right, to dealing with targeted illness. So there's a tremendous body of research behind mindfulness-based stress reduction as it relates to helping with diabetes, chronic back pain, decreasing cortisol levels, et cetera. And so we're currently working with a former chief medical officer of Aetna, former chief medical officer of Northwell, another massive hospital network, on creating 10 targeted training series that really address the 10 largest areas of healthcare costs for big employers.
Thank you so much.
Thank you.